Good. That's it.
Okay.
How you feel?
Good.
Awesome. Any pain right now?
It's less.
Less.
Yeah.
Okay. Welcome, Christine. How'd you hear about us?
By recommendation of my husband.
Okay. What did he tell you about us?
He told me that every time that he comes to see you, he does have neck spasms, and when he leaves here, that he feels a lot better.
Awesome. So you're here with a similar problem, right?
Yes.
So Nick, tell us about it.
I have had a neck spasm. Today's Friday. I've had a neck spasm since Tuesday evening that has been persistent and doesn't go away. So I came to get relief for that.
Okay, so you've never been to chiropractic before?
No,
first time. Okay, and prior to Tuesday, you didn't have neck issues, did you?
No.
Never had that. Okay, and so we did a full exam and X-rays. What did you see on X-rays? You're the expert now.
You did spinal X-rays, and it was noted that I have scoliosis, so my spine is not completely straight, and I've had a previous injury or trauma to my spine as well.
That you don't know about it,
right?
So we try not to guess, we test, right? So that's why we take X-rays. And usually it's that 1% of all my patients will come up with something that you could not foresee. And if we miss it and we adjust something without knowing, we could possibly make it worse. That's why in my previous videos I was explaining what's so important of taking X-rays. You want to know what's going on inside your body, right?
Makes sense.
The last thing we want is what? Make it worse,
yeah,
right? So we don't want to make it worse. So you have no low back pain.
No.
But something's developing. What's your occupation? What do you do?
I'm a school secretary.
So what does that entails?
Sitting at a desk all day.
Okay, how many hours?
7:30 to 3.
And it doesn't bother you, right? When you're sitting, it doesn't bother. About 80% of all my patients, they have a desk job. And what do? They're inside, focused in that. And it doesn't necessarily have to have any type of a trauma. I call it repetitive stress. If you're doing the same thing over and over, it accumulates, compound effect. So that's why we know what we're dealing with now. We're going to be adjusting you. We took some X-rays also of flexion and extension. Why did we do that? Because what I found was, what was it? An old fracture over there. It's called pars fracture. So I see this in my whole practice. I would say I saw maybe a handful. Not too much. Not too many people have it. So very important for us to make sure it's stable. So if it would have moved, something I don't want to see, right, then I wouldn't be able to adjust you in that area. But at least now we know everything is okay. We're going to be adjusting you, giving you some relief to see what's going on.
Okay.
You ready?
Yes.
Okay, let's do it. So you've seen chiropractic adjustments, right, on the videos? Yes?
Yes.
Okay, so you know what to expect. Slide down a little bit. Slide down. More. Good. Okay, good. All right, so we're gonna start with the mid back. Why do I want to adjust the full spine? Because everything is connected, right? If I release what you came in here for, which is your neck pain, but everything else is tight and stiff, the muscles will get this bone misaligned again. So we want the whole thing, right? Just not just where the pain is. Okay, I want you to relax, completely relax. Bend your knees like this and just hold them like that. Okay, hold them like that. I'm gonna start over here. Take a deep breath in, bring your arms forward. Hold it in, hold it. Good, out. Did you feel that?
Yes, I did.
How was that?
It feels very good.
It's okay? No pain with that?
No pain.
Okay, we're gonna continue right here. Breathe in and breathe out. Good. Breathe in, upper neck, let go. Woo! Did you feel that? Mm-hmm. Did you hear it?
Yes.
Nice. Any pain with that?
No.
Okay. This side, you ready?
Mm-hmm.
This side, let go. Wow. Okay, what I'd like you to do is turn on your back for me.
Sure.
Okay, slide down just a little bit. Good. Give yourself a hug. Hug yourself. Like this. Yeah. So I'm going to put my hand under your back. I'm going to push from the top. It's a mid-back adjustment. It's a different one. Okay, what I want you to do is just relax completely. Let go. One more. There you go. How was that?
It's good.
Okay. All right, we're going to be adjusting your neck area.
Okay.
What I want you to do is just relax. Can you bend your knees for me?
Sure.
That's it. Do you feel this right here?
Mm-hmm.
That's a lot of tension right here. By the way, when you came in today, what was your pain? 0 to 10, 10 being the worst.
10 being the worst when I came in. I'm going to say about a 5.
5, okay.
During the week, it's been worse.
Once we're done, you'll just let me know.
Okay.
0 to 10, what is it, okay?
Mm-hmm.
Let go. Relax more. Good. How was that?
Good. Oh, sorry.
Other side, you ready? So those cracks that you're feeling and hearing, it's when joints get stiff and waste product accumulates, unable to release that. So gas build up in the joint, and when we adjusted that crack, that sound is the gas passing through the joint, trying to eliminate that waste. Okay, relax more, let go more, relax, come on. You're kind of resisting a little bit, right? Are you afraid?
Yes.
Why?
Because that's the area that's painful.
That's painful. Okay,
Yeah.
no problem. All right, so we're gonna adjust the lower back now. What I want you to do is turn it on your side, face me. Okay, bottom leg straight, top one like this, like that. This one is over here, like this. Again, I know you have no low back pain, but it's important to realign that, okay? Relax more. Good. You felt that? Okay, let's turn to the other side. That's good. Bent. This is like this. This one is over, all the way there. Okay, this leg, don't bend, okay? Just like that. Let me have this arm. I'm gonna pull the shoulder out a little bit. Put it like this. Yeah, that's it. I'm gonna tilt. You're not gonna fall, I promise. No. Put that leg down. When you bending the knee, it tightens the whole thing here. Let go. Good. Coming up. We're not done yet. I want you to walk around. Tell me how you feel so far.
I feel a little better already.
Okay, walk around. That way. What do you feel?
Oh, okay. Relief.
How's it feel here, though?
It feels relieved.
And we're not done yet.
Okay,
we haven't
that's
done
great.
the most important part. Okay, we're gonna do what's called decompression, which you know about this, right?
I think so.
Something. Okay, lay on your back, your head over here, face up. That's good, right there. Arms up. All right, so what is this? This is, remember how we did that test? I pulled on your head and you were able to lift it better. So we're decompressing. Gravity compresses. We need to decompress your whole spine. Okay, so what I'm doing now is I'm isolating the spine. I'm not gonna pull it too hard. We're gonna take it easy on you today. Okay, put your arms down. We're gonna lift your knees. I'm gonna check the reflex. Not bad, pretty good. Okay. All right. Okay, lift your head up. Up this way, yep, like this. Put it down. Okay. What I want you to do is, you're gonna keep your teeth closed. You're gonna breathe through your nose. As you're breathing in and breathing out, I'm gonna stretch and pull. What are you gonna feel? You're gonna feel the separations of the spine and popping, hopefully, right? Okay. Releasing them. It's like a dominoes effect. Like that, okay? All right, here we go. Take a deep breath in and breathe out, breathe out. Relax the shoulders more. Relax your shoulders more. Squeeze your knees for me. That's it.
Okay.
How was that?
It was interesting.
What did you feel?
Feels good.
What did you feel inside? Like, what was it? If you were to describe it.
Like how you described it, like a separation.
Was that painful at all?
No, it was not.
Okay. All right, so we're gonna adjust your ankles. Completely let go. Nice. Let go, let go. That's it. Did you feel on this one? Yeah. Okay, the way to get up properly. is completely turn on your side. Good. Use the arm to push up. Perfect. All right, let's come around here, facing that way. We're gonna adjust your shoulders. Before that, move your shoulder. You said it was bothering you. How's it now? Any different now?
Feels better than when I came in.
Beautiful. If you were to say 0 to 10, what is it right now?
0 to 10, 10 being the worst.
You said it was a 5. What is it now?
4, 3.5.
4, 3.5. So about what? 20, 25% better? Okay. Let's go like this. All right. So what you're gonna do is you're gonna push back like this, okay? I'm gonna push it this way, you're gonna push backwards.
Okay.
Okay? And go. Good. You felt that one? That was your shoulder. Okay, this side, you ready?
Yes.
Let's see, go. No, you're pushing back.
Oh, sorry.
Hold on a second. So this is what you're doing. You're pushing this way.
Okay, no problem.
Ready?
Sorry.
No problem. Go. No, it doesn't work so. That's okay.
It doesn't work.
But this is the tight
This
side.
is the problem one.
Okay, relax more. Relax.
Sure.
Good. Awesome. Awesome. How you feel?
Good.
Awesome. Any pain right now?
Right now,
Less?
it's less.
Less.
Yeah.
Okay. Thank you for coming. I
Thanks for
appreciate
having
it.
me.
Awesome. That's it.